Thank you, Speaker. My question is to the Premier. Good morning, everyone. Speaker, the Premier has said numerous times he respects and listens to the medical experts, including those who run our public health units. Well, my health unit in Windsor and Essex County has joined 16 others already on record in support of paid sick leave during this COVID-19 pandemic. In fact, a letter to the Premier this week calls on the Premier to support Bill 239, the Stay at Home If You're Sick Act, and that bill, Speaker, as you know, was introduced by my colleague from London West. Speaker, will the Premier listen to the medical experts, accept their modelling projections that Ontario will not be able to control the virus without the safety of paid sick days?
Parliamentary Assistant, Member for Burlington.
Thank you so much, Speaker, and I thank the member for his question. My daughter is also a nurse in Windsor as well. But here's what I'm so proud of. I can tell you this. Our government, led by our Premier, has worked relentless in the last year to make sure that everybody, every worker, every employer, and every employee has paid sick days. On February 19th, the Government of Canada announced a proposal to double the number of paid sick days for 2 weeks to 4 weeks. This will provide workers up to 20 paid sick days. I am very proud of that, and I also want to say this again. Premier Ford has demonstrated that is leading a collaborative approach to supporting workers in Ontario by partnering on initiative with the federal Liberal government. I'd invite the NDP again to drop their partisan language and begin working with us for the betterment of the workers of Ontario.
Order. Supplementary question.
Well, Speaker, we all know the federal program is flawed, it's cumbersome. Earlier in an answer, the government said that they listened to the experts in Thunder Bay, the public health experts, and the Premier said, we can't say one thing and mean something different. So, Speaker, in the letter to the Premier, the health unit says more than half of Canadian workers do not have access to paid sick leave through their employers. 70% of those earning less than $25,000 don't have paid time off when they're ill. And those earning less than $30,000 are twice as likely to contact COVID and nearly 3 times more likely to end up in the hospital with it. We all want an end to this pandemic. Bill 239 helps us to do that. Speaker, why can't the Premier see the need to augment any federal contribution with a made-in-Ontario solution for paid sick leave during this global pandemic?
And again, to reply, the member for Burlington.
Thank you so much, Speaker. I first want to say that the NDP continues to provide inaccurate information to Ontarians by purposely failing to mention the federal paid sick days. And the reason I say that is we've said it over and over again.
To withdraw. Withdraw.
Mitigate again said is that my Minister of Labour, Training, Skills and Development, has done a phenomenal job working with his federal counterpart. People were complaining it was taking far too long to be able to get the monies that they needed to receive for sick pay days. They're now getting it within 3 days into their account, and the people are very excited and very thoughtful that that was able to happen. I also want to say again, it's our responsibility in this House to make sure that the people out there know of the monies that they're able to get. I will reiterate what I said last time. There's been 110,000 Ontarians that have applied. To date, only $271 million has been accessed nationwide, meaning that there's still $800 million waiting to be spent. Why would we duplicate something when the program has 73% that's unspent?
Response? Thank you.